Hello,
Hi,
Dr. Goodwin.
Hello, how are you both?
We're doing well, thank
We are
you.
well.
Good. So we're going to talk some about the Alzheimer's survey this morning.
That's exactly right.
Okay, I understand that the survey provides information about how much money and other assets caregivers of persons with Alzheimer's end up having to spend, and the fact that in many cases they contribute much more than they know in caring for persons with Alzheimer's. Is that correct?
That is correct. In our 2016 Alzheimer's disease facts and figures report, the Alzheimer's Association looked at what was the...
Hold on 1 second, so that our audience is the 1916 or 15?
It's the 2016 report.
2016. And what's the name of the report?
It's the Alzheimer's disease facts and figures report.
And figures report. Is that on the internet?
It is. You can get that at www.alz.org.
alz.org.
That's
okay,
right.
I just wanted to get that information for our audience. Now, tell me something about it.
Yeah, in the report, we found that people taking care of somebody with Alzheimer's or dementia were making enormous personal sacrifices. Up to 50% of them were having to make decisions about basic necessities, things like food, medical care, transportation. 1/3 of our survey respondents, Dr. Goodwin, told us that they were struggling with putting food on the table because they were caring for somebody with Alzheimer's disease. This is significant, yeah.
And Beth, how serious is the problem of Alzheimer's for caregivers?
Well, in the United States today, we have over 5 million Americans living with Alzheimer's disease and nearly 16 million caregivers. So the numbers are only going to increase as the baby boomers age. This year, the baby boomers turn 70, and the greatest risk for Alzheimer's is age. So as our population gets older, there's going to be more people at risk for getting Alzheimer's disease.
And do we know why?
Well, one of the things we do know is that as people age, the risk seems to go up. The scientists are still trying to figure out exactly why that is. What we know is that Alzheimer's is not normal aging. We used to think that when people got older, this was just something that happened. What we have been able to determine now is that it is not normal aging. It is a disease. Some of it's caused by Alzheimer's, some of it's caused by vascular dementia, and that there's some other causes of it, but most of the cases of dementia are caused by Alzheimer's, and it's not normal aging.
Does the incidence vary according to, for example, race or ethnicity?
It does. Unfortunately, what we know is that African Americans, for example, are twice as likely to have Alzheimer's disease, while Latinos are 1.5 times as likely to have Alzheimer's disease.
Okay, and we don't know why yet.
We don't. There's many clinical studies being run, and they're trying to figure that out. We also know that 2/3 of Americans with Alzheimer's disease are women. So women seem to get the disease more than men, and they're trying to figure out if that's only because women live longer, or if there's something else going on that causes them to get it more often.
And I have heard at times that with African Americans, for example, with increased incidence, it may be because of the increased incidence of hypertension and cardiovascular disease.
Yeah, we think that the scientists that I talk to tell me that keeping our brains healthy is important, and while it might not prevent Alzheimer's disease, it can prevent some of the other dementias. And it could very well be that African Americans who are at higher risk for things like hypertension and heart disease, diabetes, stroke, that those things all may well play a part in whether they get Alzheimer's disease.
Now, before we end our conversation, what would you recommend, either of you, to make it easier for caregivers to care for people with Alzheimer's without, and at the same time, give themselves proper care?
Well, that's an excellent question. Caregiving is like being on a treadmill, and it's really hard. A lot of caregivers quit taking care of themselves because once they start into the process, they don't know how to do that. So through the Alzheimer's Association, caregivers can get education that helps them figure out that that's important and how to put into place having someone else care for their loved one while they take a break, go to the doctors, keep getting their vitamins. For me personally, my wife, Chris, started showing signs of Alzheimer's in her 40s. And so I ended up in the hospital. They thought I was having a heart attack about 2.5 years in. I'd taken care of her for 2.5 years, 24/7. And the stress and strain of the disease was starting to take its toll on me, and I was in my 40s. But that prompted me then to figure out ways to ask for help, have others come in and give me a break so I could stay rested, so I could take care of her through the rest of the disease.
Yes, I'm glad you mentioned that. I should have mentioned that you yourself had been an active caregiver for a number of years because your wife had had Alzheimer's disease, and that you subsequently became an advocate.
Yes, I mean, once you've lived through it, with my wife's family history, I know it's destined to repeat itself, and so I became an advocate 8 years ago. I'm in Washington, D.C. right now for the Alzheimer's Association Advocacy Forum. We're going to meet with our legislators and lawmakers tomorrow, and the goal will be for them to increase funding dramatically so that we can have an impact on this disease. Out of the top 10 diseases in America, this is the only one that doesn't have a treatment or an effective treatment or cure. And so, you know, we're there to do that. We also are looking to get support for the Hope for Alzheimer's Act, which is a piece of legislation that allows for care planning. When someone's diagnosed with Alzheimer's disease, the first thing that will happen is they can spend some extra time with the doctor to talk about what's going to be coming in this disease and how they can plan for it as a family and face it.
I see. All right. Well, I certainly enjoyed talking to both of you, and I'm sure our Health Power audience will learn from the conversation that we've had. And both of you have a good day.
Thank you so much.
Thank you, Doctor.